We have another community update, and I'm Bill Blackburn, Mayor of Kerrville. Uh, this morning, as we have done so many times before since March, we want to share information from several different perspectives about the coronavirus, excuse me, the response. And so today we have Chief Maloney, Fire Chief, excuse me, Corey Edmondson, CEO of Peterson Health, and we may have at least one other. Yes, after Corey will be Deb Thomas, Emergency Management Coordinator for the county, and then I'll do a conclusion. So, Chief Maloney, will you begin?
Thank you, Mr. Mayor. Morning, citizens, Kerrville and Kerr County. Give you a brief update, a little bit about where we are with COVID in the community with a slide presentation. Next slide. So what we're seeing overall in July, that we started off the month with 255 active cases. We peaked on around the 14th with 498. You can see the 2-week period from there that caused that peak, just under 500, and then slowly stayed in the 300s. And then at the very end of January, as of yesterday, we're down to 253. So we have been in the 300s, almost as high as 500. So yes, the trend does look like it's moving down in regards to that, but I do want to remind the community that in the beginning of November, we were at 72 cases. So we have maintained in December and January 300 active cases for the community. So we need to be mindful of that moving forward. The January, the bottom line there shows the hospitalizations. Once again, beginning of January, we were at 31, peaked at 34, and now as of yesterday, we were down to 10. Once again, I'll leave Mr. Edmondson to talk about that with Peterson, but tread lightly on that because that is a big impact to our community, our healthcare here with the hospital and emergency medical services. Next slide. So I kept this up on this slide here for cedar fever and COVID because all of us are still feeling the cedar fever out there, including myself. So I thought it was still important to share the differences between them and specifically the ones that are very common there, because we need to be cautious that we don't just chalk it up to I have cedar fever when in reality you do have COVID and could potentially infect other people at your workplace there. So we've seen this in the fire department specifically. We are doing testing at the fire department before they start the shift. And there are 6 individuals that came to work that had those common, that very common thing from cedar fever and COVID turned out to be COVID. We were able to catch them before they came on shift. So those common things you look at is the fever, the aches and pains, the sore throat, runny nose, fatigue, and loss of smell. So keep an eye on those, watch the differences between them. So be cautious, and we are almost out of the cedar season. Next slide. So our testing options really haven't changed. So we still have those. The only one I've removed off the list was Bernie, because we seem to have a pretty good ability locally to be able to manage that. So Peterson Urgent Care is still testing the symptomatic patients. So Peterson Medical Associates on Bandera Highway, you can call the main number at 896-4200 for an appointment. And then Franklin Clinic over at 723 Hill Country Drive, they now have an online calendar that is available to pre-register. So you can go on their website, you can take a look at the day, and they'll tell you how many openings they have either at 11:30 or 3:30. Next slide. So good news for here at Kerrville is why we took the Bernie off is that we do currently have the free public testing. This is the last day for it. It's from 8 to 4 at the Hill Country Youth Exhibit Center. They have been doing 5 days of testing out there. They will be next in Fredericksburg at the Lady Bird Johnson Park at the Pioneer Pavilion on February 15th through the 18th. They will be back again in the Hill Country Youth Exhibit Center, and we will provide that information to the public when it does become available. Next slide. So where we've been, so the vaccine in regards to the Kerr County demographics. So we have really been focusing on, as multiple organizations, City of Kerrville, Kerr County, Peterson, in cooperation with HEB also. And we've really kind of focused on that phase 1A healthcare workers. We feel comfortable at this time, and I'll leave that with Mr. Edmondson too, that we have achieved that goal of our healthcare workers. That there may be a few, but for the majority, we have completed that. So our focus now is going to be on that phase 1B. So interesting facts for Kerrville coming from DSHS is that there are 14,000 residents are 65 plus, and they've also identified that there were 14,000 residents between 16 and 64 with any medical condition. So this is a big focus group for us. It's something that we are taking very seriously, and we are working toward to achieve that. We will achieve that goal, but we are still in a limited supply. This is a straight supply demand issue. And so we are still working with that in order to achieve that. This is not similar to the flu vaccine where we have a large supply. We have a very limited supply for that. Next slide. So learn about the vaccine. So I encourage everyone, the Department of State Health Services at dshs.texas.gov/coronavirus, they have a lot of information now available for the COVID vaccine. So they have some sites and links on there that has a list of the different hubs. They have a list of all the vaccine providers in Texas. They have interactive maps of where to find them, who to call. They also have interactive maps on there of who's getting the vaccine, how many vaccines have been administered. So I encourage you to take a look at the website on there to get that information. They also have good information about the education. They have the links to the CDC and the FDA. They have the frequently asked questions about the vaccine, and they have some other dashboards that are also available on there. So there's a lot of information out there. This is an excellent resource, a credible resource in order to learn about the vaccine for yourself. And as always, I ask for our community to please be patient and kind. Our priority here is to protect our community and your loved ones, and we're going to continue to work toward that. Thank you, Mr. Mayor.
This time, Corey Edmondson from Peterson Health will share with us information.
Thank you, Mayor. You know, I want to start out and say Peterson has a hope for healing. And I use that term because we see some light in the tunnel. And let me share with you. Just in the last week, and I want everybody just listen to this, knock on wood, but just in the last week, we started to see a trend downward, and Chief Maloney shared some of that from hospitalization and the number of active cases in Kerrville, and that dovetails with what we're experiencing here at the hospital. Let me give you some statistics really quick. From Christmas to the mid-January, we roughly had a 27% positivity rate, meaning those patients that we tested that thought they had COVID or wanted to get tested for COVID, 27% of them tested positive. In the last half of January, and that dovetails with Chief Maloney's slides, that started to trend down. So from the 16th of January to the end of January, we had a 16% positivity rate. In the first few days of February, 10% positivity rate. You know, I would love to say and think that we as Kerrvillians are doing all the right things. We're wearing our masks, we're social distancing, we're doing the right thing. And let me tell you what that does for my employees here in the hospital. That has caused the number of patients in the hospital to decrease as well. When we hit a 30 plus number of patients that were in the hospital that had COVID, and we were just fatigued and exhausted, today we're hovering around anywhere from 8 to 12 on any given hour. That's a huge difference from 30 plus down and cutting that in half. That is phenomenal. So thank you, Kerrville, for doing what you need to do, and things are right. And I think the vaccine is helping out. People are trying to figure out where to go get the vaccine that I'll discuss here in just a second. But those are some positive trends, and that's why we say we see a little light in the tunnel, and we have a hope for healing. Our staff continues to do a great job. The vaccine rollout. Some of you have seen and are monitoring how many vaccines Kerr County is getting as a whole. We have roughly 8 to 9 vaccine providers. Those are people who actually get sent the vaccine. Peterson being one of those. And last week we received 300. And we feel confident now, and we put on a clinic Wednesday where we vaccinated what we felt were the remainder of 1A healthcare workers at Peterson and in Kerr County. We made it public, doctors' offices, our own employees. We vaccinated all those, and a few 1Bs that were that hit that mark that were also healthcare kind of related, that had some healthcare responsibilities. So we feel confident that we're done with 1As, and now we can focus on 1Bs with any future vaccines that we do have. That vaccine clinic went off perfectly, and then on the next day, Thursday, Doug Thomas may talk about a little bit more. I will tell you from a personal perspective, I went over there a couple of times. We did a mass vaccination clinic at First United Methodist Church, which we're thankful for the church opening up. But there was a collaborative approach that we've been talking to you about for 12 months now with the city, the county, Shriner, with Peterson and other entities who are collaborating from the very beginning with this COVID to try to take care of Kerr County and doing all that we can and to be responsible about. Well, we got the vaccine in Kerr County, and we were able to deliver at least 400 of those yesterday in a mass vaccination clinic, which is phenomenal. It just shows that we can vaccinate more than that. We can vaccinate 1,000 and maybe even 2,000 a day based on our plan. We've been able to do that because we've done it with the flu vaccine for 10 years. We can do that with the COVID vaccine. So that kind of gave us a little, we were able to kind of tweak some things that we thought maybe we could improve on. And every week that we get a vaccine allocated to Kerr County and we collaborate, that we can do a mass vaccination clinic, we will. And we'll improve upon that each time. So it's nice to hear from people of where we can improve. We appreciate the kindness that people bring to us where we can do that. But that was a positive thing on Thursday. Moving statistically speaking, since the beginning, I'll just tell you really quick. To date, Peterson has tested over 17,000 people. There have been over 2,300 positive cases in Kerr County. And yesterday we had 11 cases, which is way down from what we have been experiencing on a daily basis, and all's going well. Unfortunately, there have been deaths, and you know about those. And in total, we've had 78 deaths as of yesterday in Kerr County as a whole. And that's happened in a variety of venues, whether that's in San Antonio or here in Kerrville for some reason. But the statistics are still there, and this is still a serious thing going on. The new variant of the vaccine that's out there that people are hearing about, there's still a lot of discovery with that. We're hoping the vaccine, from what they can tell, is still effective against the variant, but doing all the right things to keep that at bay is still going to be important. So let me hit on some photos really quick for you. And this is all about the rollout. And I'm going to flip through these really, really fast. But this is the check-in process that we had in our home health building with all of our employees and healthcare workers next. And then the registration process that we have went off without a hitch. Next. And these are the vaccinators, and this is our pharmacists who are drawing up the vaccine. So that's kind of how it's done. Because you have vaccinators on the left and who are sticking you in the arm, and then you have pharmacists that are drawing up the vaccine. And you can see in that little vial there, you can get so many vaccines or so many doses out of that one vial. Next. And then people were getting vaccinated at that point. The next picture you see on the right is our community. So the next day, we were doing the same thing. At the First United Methodist Church across the street from us. Again, we're checking people coming in. Shriner University, nursing students were helping us. This is a collaborative effort. Next. You had the registration process, so they checked them in, make sure they were safe. Then they came to the registration desk, make sure that we had their name on our registration. And then again, pharmacists on the right from HEB who were drawing up the vaccine, who were checking people in as well and making sure all was well and doing some vaccination. Next. And then people getting vaccinated. It looks simple, but I'm telling you the logistics to get this done, there's a lot going on behind the scenes. but we've made it a well-oiled machine, we feel like, and are tweaking and improving upon it. But the community ought to be proud that we've put something together. And as we get vaccines, we're going to be doing that. I think that's the rest. That's all the pictures for now. We just want to talk about a couple other things real fast. The helpline. I know the county's got their helpline going, and Peterson does too. Our hotline is 896-4200. Press option 1, and happy to answer any questions about what's happening with the COVID and with the vaccine and all. We've also got on our website a frequently asked question piece that you can go through as well, so people can go to our website and navigate that as well. Hopefully that can answer some questions for you before you feel like you have to call. Maybe that can get to all your questions. So I also want to thank the community for lifting our spirits. Probably a few weeks ago, I said this was like in January, early January, we were having 35 patients in the hospital. We were fatigued. We were going on 11 months of this. And I'll tell you, the community came out and they have been lifting our spirits ever since. I alluded to this the last time I talked to you. Shriner gave us food trucks and fed our staff. Into the Hills has done things. But let me throw up some more pictures here of some others who have lifted our spirits. On the left, this was a patient that was in the hospital on the 3rd floor who was so thankful for what we did for her. She's like, I want to feed those nurses. And she came up and fed us. And on the right, we had Atmos Energy who came and fed us as well. Into the Hills continues to feed us, and they came and fed the EVS and our other nursing departments. Next. And we had a doctor who was nice during our clinic that we were doing and brought all the registration people and vaccinators some chocolate to get them going in the right direction. So that's enough pictures for now. So thank you. So I'll leave you with this. Those things are important to us. They've been valuable. Thank you for lifting our spirits to help us move forward. We continue to attack this thing as a community, as a staff here at Peterson. I feel confident in that. We've got great leaders who are leading the charge here. I know people are frustrated. I know they're frustrated with not getting the vaccine, and they're frustrated thinking that something is going on behind the scenes, that we're not getting the vaccine. But I will tell you, I'd love to say that we've got control of that. I'd love to say that we've got control of the vaccine and of the state and of Boston to say, get us vaccine, but we don't. We are left to them to send us vaccine. We've been fighting, we've been calling senators, we've been calling representatives, we've been calling the EVAC committee, we've been calling Texas Department of State Health Services. We've been doing things to rattle the cages, so to speak, to get the vaccine here. And I believe that our efforts in the last couple of weeks to do that have proven that we did get some vaccine last week. Will we get some next week? We'll know that this weekend. I hope so. There's no guarantee of that. And we're going to send these same pictures and everything to the state to say, look what we did. We collaborated as a community. We were able to get the vaccines out, the most vaccines that any in the region in one day that anybody's been able to do. We're doing that. We're acting like a hub, but we just need the vaccine. We can act like a hub. Just give us the vaccine, and we can do it. We can do 1,000 a day. But I tell you that as we are working hard to get the vaccine here, and appreciate your patience, appreciate your kindness, as Chief Maloney said, in what we're trying to do. We're here for you. We're trying. We're in it with you. We're not in this alone. There's no roadmap for COVID. We've been playing this out, and we've been trying, and we've been putting proactive things in place for COVID for quite some time. But we're doing it together, the best we know how. So just like a road trip, we're always asking, are we there yet? Are we there yet? Well, we like to say, yeah, we're there, but we do see light in the tunnel. We're just going to tell everybody, yeah, a few more minutes, and we'll be there, or a couple more hours. But we've got a little bit more to go, and we appreciate you standing behind us along this journey. So I'll leave you with that. Thank you, Mayor.
All right, thank you, Corey, very much. At this point, Deb Thomas, Emergency Management Coordinator for the county, who has worked so hard through all of this, is going to give us some info. And Dub, I hadn't given you a heads up on this, but if you can remind folks about the 830 information line and the 800 number as well. All right.
I'll do that, Mayor. Thank you. Good morning, everybody. So like everybody else has talked about this morning, we ran a vaccination clinic yesterday, mass vaccination clinic, and it was very successful. Like Mr. Edmondson said, it's been a collaboration between the city, the county, Peterson Regional, Schreiner University. It worked very well, and everything went very smoothly. And there's no doubt amongst the group that we believe we can run 1,000 folks a day or a little bit more than that, even just through a walk-through facility. If we do a walk-through and a drive-through, I think we could push 1,500, maybe 1,700. So everything worked very well. I was very proud of everybody. I want to thank Kerrville First United Methodist Church, Pastor David Payne, Pastor Donna McGee, Sarah Lohmeyer for all of their help. If it hadn't been for, they went out of their way to give us the use of this facility, as well as make sure that we had everything we needed. Also, the volunteers at the call center, I want to thank them for their work. We're working from 8:30 to 4:30 every day. There's 2 shifts, and they're answering everybody's questions as best they can. If not, they give them to me, and I try and call folks back as much as possible. There is the number to the call center is 315-5900. There's 4 lines there, but the 5900 is the main number. And if it's busy, it'll roll over to the next one. Some of the other things I wanted to talk about is the 800 number that the mayor referenced. So the 800 number to register for the vaccine, if you don't have a computer, is 1-800-811-8620. You can also find information for the vaccine registration that we used with our provider was HEB. That's also listed on the website, but I'll go ahead and give it out here. It's https://vaccine.heb.com/scheduler. So that's going to be the website that we're using for right now. That's our mass vaccination hub provider. And once that opens up, we'll again do another code red. We're going to try and give folks a little bit more advance notice than last week. There was a little snafu with that, but I think we've got all those issues worked out. And I think hopefully I hope we get enough vaccines next week where we can run 1,000 people through a clinic, just again to show the state that we're able to do that, and that we can possibly vaccinate even more than that at one time. That's all I have, Mayor. Do you have any questions?
You want to say something about Code Red?
Yeah, the Code Red system is the county's emergency notification system. And that's what we're using to notify everybody that the website has been open and the 800 number is available. Like I said, we're going to try and give everybody a little bit more notice. But you'll receive, if you're signed on to Code Red, you'll receive the notification via voicemail, text, and email. And once you've gotten those, you can go onto the 800 number or the vaccine provider hub and sign up and register. Access to Code Red, you can access it via the county's website. Right on the front page, the main web page, there's a big icon in the top right-hand corner that says Code Red registration. It's also on the city's website. So if everybody will sign up for Code Red, and we're signing up folks at the call center if you're having problems signing up, or you can call my office and I'll work to get you signed up as well. So Code Red right now is our main notification system for letting everybody know that the vaccines are available and how to register.
All right. All right. And let me ask you this. If you've got Code Red on your phone, beyond this issue, if there's a flood, tornado, hurricane, you would get some kind of notice. Is that right?
That's correct. It's our emergency management warning system, basically for any type of natural disaster, including this pandemic.
All right, good. Thank you. Thank you.
Yes, sir.
I want to follow up on what has already been said. Something I think that is very important to think about. Last week, I was in Austin talking to an executive at the Department of State Health Services. And she said two key things that they look for in a community in regard to the distribution of vaccines. One is that there's a collaborative group, that folks are working together in the community to make this happen. The second is capacity to carry out the vaccinations. And as Dub just mentioned, we can do right now, we can do 1,000 to 1,200 vaccinations and possibly more than that. But one of the things that I clearly saw in the visit to Austin was this: there are 28 million Texans waiting to be vaccinated, maybe a little bit less after this week. 28 million, and then there are 330,000 vaccines that come out every week. So as you can see, that is going to take a while. And that's related to shortages for vaccines all over the state. The other thing I found out in Austin, should have anticipated, there are people from cities and counties all over the state calling, complaining, saying, where are vaccines? Why don't we get more? So it's a tough time in that regard. How do we increase the supply? How does the state increase the supply? Right now, we have two approved vaccines, Pfizer and Moderna. Those were approved in December, and then in January, the state started distributing vaccines. Johnson & Johnson is probably going to get another vaccine approved before long. AstraZeneca may get a vaccine approved, and then also Novavax. So we potentially could have, and hope we have, more vaccines that are safe and approved and tested. And so this week, we've done 1,400 vaccines here in the community. Something that a lot of people may not know, in addition to the community vaccines, the state provided the Kerrville State Hospital with vaccines for patients and staff. In addition, the federal government has provided vaccines for the VA and also for nursing homes. So in addition to the community vaccines, we've got those going on as well. I just want to say that yesterday I went by the Methodist Church to just see how it was operating. It was smooth, friendly, organized, efficient. And the shrine, I had more than one Shriner, a nursing student, say to me that people had expressed all day how smooth that was, how nice everybody was to them, how it was just working great. And I just feel like that is just a huge model for what we can do and expand. The other thing I was going to say is not everyone got a vaccine. We've got a lot of folks that are waiting. And we are working to get there. And you know as well that the vaccines being distributed in Uvalde and Fredericksburg and San Antonio. But together, we're going to get this done. And I hope coming out of today, this community report, you have increasing hope about us getting there. I know folks don't like to hear be patient, but we're making real progress. Thank you very much for being a part of this community update today.